Hello, thanks so much for watching these videos. What we're trying to do here is really get you some important information to make this decision and this journey much easier and have you much more well-informed as you go through this process and decide if plastic surgery is right for you. So for every procedure that we perform, all the major procedures that I perform, I have a video on this website so that you can go to that and watch a particular video at each point along your journey, both beforehand in total if you'd like, just to get a bunch of information, and then as we go through, so that this way you won't really just be having to collect and remember all that information right when you see me. So these videos will be very important, both for just informational purposes, for your pre-op portion of the procedure and your post-op portion of the procedure. But they're also giving you great information, and they're also going to give you some important safety information. Some of this information you won't actually hear me say during our visits together, so it's very important that you do watch these before. My patient coordinator, Robin, will send you the first couple video links basically at the time that you request a consultation so that you get a bunch of information right then. And then it'll be basically your responsibility to go back to the website, you'll go to your procedure that you're having, you'll click on the link that basically follows through. So for example, if we're at post-op day 1 coming up, so you've had your surgery, post-op day 1 is coming, it's great to watch that video before you see me. You'll get a whole bunch of information, make things a lot clearer for you. And then if you have any particular questions, just ask me, and that way you feel that you've gotten everything you can out of it so that you're not wondering and concerned about certain things. So hopefully this is going to make things a lot more simple for you, give you a lot of information, and make things better. So first off, let's talk about the facilities. We have 2 facilities, one in Sacramento and one in Granite Bay. I do most of my consultations at the Granite Bay office, so you'll be coming to the Granite Bay office for the most part to see me for a consult, and most of the visits will be there. There'll be a few opportunities for some Sacramento visits if that's closer to where you live and that's more convenient. But the surgeries are done at both locations. We have a surgery center at the Sacramento office, which is there on Scripps at Fair Oaks and Howe, basically. And then we have a surgery center at the Granite Bay office that's at Sierra College in Douglas. There's directions on my website that'll show you how to get there, but particularly for the Sierra College address, it's a little difficult, but it's in a business park up behind. As you enter there off of Sierra College, you'll kind of weed your way through and you'll see that. So call our office if you have any issues, but sometimes people do have a little issue with that. But at both facilities, you'll get great, awesome care. We have an awesome staff, nurses, scrub techs, full team that will assist you with that. But just kind of to let you know how the consultation's going to go, just so you can have some information to know what to expect. You'll be talking with my patient coordinator, Robin, before. She'll get you some information. She'll email you, she'll call you, all of that sort of stuff. You'll also get some paperwork. It changes a little bit at times how you get that, but sometimes through email, sometimes through the mail. If you can fill that out beforehand, that helps us a ton. It'll also speed along the process for your consult, and hopefully we can get you in and out in a very timely manner so that we don't hold you up for your day. But if you can do that, that would be great. Provide your insurance information, just a little topic on that. People always ask questions, do they need to provide that? If you do, that's awesome. We just have record of that. It's not something we need for any particular purpose, but it's great to have on record because sometimes we do send out some pathology, some labs and things like that. And if we have that on record, it's more easy for you to have that covered by your insurance and not actually have to pay out of pocket for that. So that can be very helpful. Make sure you know your medications, document that on your paperwork or bring those in that day as well. That helps me as the doctor be able to counsel you and let you know things that may affect your surgery before or after, so that's very helpful. You'll go through that, you'll come in, you'll have all that stuff ready, take you back, you'll meet me in my office at first. And we'll do the consultation in there. I will talk you through that. You're going to get a lot of that information on this next video that you're about to watch that'll give you a bunch of information to help answer some of your questions. But we'll go through some before and after photos as well, so you can see that and kind of, because basically part of your job as the patient is evaluating me. You need to see if I am good at what I do and if you feel comfortable with that. So we'll go through all of those things as well. And then once we're done with that portion, we'll head back into one of the exam rooms, and then with the assistance of one of my medical assistants, we'll perform an exam that's pertinent to whatever we're talking about that day. And then based off of that, I can really tailor what your desires are to what's appropriate from a surgical standpoint. We'll talk about those things. We'll talk about expectations. We'll talk about what's right for you, what's safe for you, that sort of thing. And then once we've done all that and kind of formulated a plan, Then we'll go and I'll introduce you to my patient coordinator, Robin, and she'll talk you through everything else. She'll basically go through the financial side of things. I leave the bad news up to her. I try to just stay on the good news. But she'll go through all of that with you, talk about financing and options that are available to you. She'll also talk about scheduling. You can look at the schedule that day if you'd like. She can give you some possible dates in the future if you'd like, and just answer any questions you may have at that point. And then at that point, we just leave it up to you. We're not car salesmen, so I take plastic surgery very seriously, and so I want you to be able to make a right decision for you. So we're not going to hound you about your decision or anything like that. We just give you the information and let you make your decision. If you decide to proceed that day, you can set everything up with Robin. If you decide to think about it, which is a very good thing to do, talk to your spouse or your significant other, and then you can call Robin back at any point. So just also a little thing that some people ask about a lot of times too is our paperwork does say that your consult fee and your pricing, your financial information is good for 3 months. That's kind of the documented thing. Just to give you a little comfort level, I usually honor that for about a year. That way that gives you time to think through things. So if you need some time to make sure this is right for you, to formulate your finances and that kind of thing, you generally have about a year that everything we talk about from a financial standpoint is the same. So just a little off-book thing for you to know. But then we leave it up to you. If you decide to proceed, you'll be getting back in touch with Robin. She'll set everything up for you. And then at some point, usually about 2 weeks or so before surgery, you'll come back and see me for a pre-op appointment. And we'll go through more details and that kind of thing, really get into some specifics of the logistics and post-operative care and that sort of thing. So that's basically what's going to happen on your consult day. So hopefully that kind of gives you a roadmap for what's going to happen. And then in this next video that you'll watch, we're actually going to talk about your specific procedure that you're going to be having. I'll give you kind of the basic rundown for what that is, the details, and hopefully that'll give you a foundation to help as you formulate your decision on this process. So thanks so much. I look forward to meeting you soon, and we'll see you then.